Okay, did you have any other questions that you needed answered?
Yeah, I've seen on here before it says proximal air or distal air. What's the difference between?
Proximal means, a proximal occlusion means near the bag. Distal occlusion means towards the patient. So maybe the tubing bent by the arm, or maybe it's become infiltrated and it's not pumping the way it should be, or maybe the patient accidentally, they've got the clickers on there. Maybe it accidentally got locked, and those little clickers are pretty tight. If once they're locked, they don't let anything through, and these pumps are very sensitive to pressure because sometimes when you use a syringe on the second port, the syringe, because you have to make sure that syringe has been opened and kind of closed before you put stuff into it so that it'll slide easily into here, because sometimes it's too much pressure and the pump will keep alarming. You have to sit here with your finger on the syringe while it infuses because the pump won't let it go through on its own. But yeah, proximal is towards the bags, so it meant that the air occlusion was coming from up in here, and distal is towards the patient.
Okay, and so once you
figure out where it's at, if you read it and it says distal, then you want to check, did I leave it locked, or did I just start this and the patient's saline lock was locked and I forgot to unlock it? Which I've done with the ports, because those, like I said, those little clippies are really tight, and I've started something and I started to walk away and the pump alarmed, and I go back and it says distal occlusion. Usually it's that little white clip that's locked up. And you unlock it, and then sometimes you have to clear some air out of here because it will get air in there as it's trying to pull fluids or push fluids.
So after you find it, how do you start it again, or stop it from beeping?
You stop it by fixing the problem and then restarting it. And then it'll go through the start all, start A, start B. Tell me what you want me to do, and you say start A or B or whatever you want it to do. So B, I'm going to go concurrent, change mode, and I'm going to, let's see what the other programming options are on here. I think it's just, no, that's not what I wanted, cancel back. You can put it on standby at this point. You can put B on standby. You can get your drug list up at this point if you decided that's what you need at this stage. You can cancel back. Once you enter your numbers up here, like 1 hour, you want to delay this 1 hour, you hit enter. So it'll go back to B, and then you have to start it and then make sure they're both running the way you want them to be. Now, you're going to have patients or patients' kids or patients' visitors that get interested in the pump, and say you're giving a drug, you don't want it to change. You're giving a heart med, you're giving cardizem, and you don't want it to be boosted up to 200 milliliters an hour. You only want it at 5 milliliters an hour. There is, on the back of this pump, a manual lock switch. It's just a little tiny toggle switch in here, right below this volume switch. So if you want it to be locked out, I can't remember which way was up or down now. If you want it to be locked out and nobody can change anything, it's locked out.
Does the screen show something now to show you?
It says hard locked enabled.
Okay.
So I know when I come in that either I locked it or somebody else locked it, because here it is, hard locked enabled. And then if I need to change it, I can undo the locking back here and change whatever I need to change, Say the doctor raised the rate to 150. And then I can start. And then I'll lock it again because I don't want anybody playing with it, because I've come in the room and found it at 200, so we don't want that. So, see? And it stays blank until somebody touches the screen, and then it says hard lockout enabled. So, okay. Okay, so I talked earlier about stopping the pump. So, okay, I've got this all set up. But I knew the patient was going to have to go to radiology eventually, so I told him, come down when you're ready and I can stop it, the infusion, and we'll restart it. Okay, so I'm going to stop, and it's going to say, do I want all of them stopped? Then I'm going to say stop all, and then I'm going to turn off the pump. Okay?
That was that yellow button, the on.
Right, the very off on. So then I disconnect it from the patient, I put a white cap on it, I just leave it sitting here, and they go off to radiology and get done whatever they're going to get done, or to ultrasound or wherever they're going. They come back, I hook the tubing back up to them, and then I'm going to turn my pump on. And it's going to calculate, it's going to calibrate. Make sure nothing's locked up here, because it'll almost tell you immediately if they can't get any flow through here. Do I want to clear settings? And then it says yes or no. No, I do not want to clear my settings. I want to go back to where I was, and I want to be able to push start. Do I want to start all? Yes. And there it goes. It delays for just a second because it's still checking, and then it'll start pumping. There it goes. Okay, so what other question did we have on that? Oh, okay, so say we have gone through the calculations, say, okay, I'm going to stop B. B, stop. Stop B. Okay. I want to change this because the doctor says now he wants a cardizem drip put on this person. So I'm going to go to therapy, and I can still run it concurrently because it's going to run at a low enough rate. And I'm going to find cardizem, so I'm going to page down till I do. I thought I was going to. What's the other name for cardizem? Diltiazem. Let me go. See, it's good to have a partner. Okay, I found diltiazem. I'm going to enter diltiazem. Do I want a loading dose? Do I want to just start with my dose calculations? Usually we give the loading dose before we ever put the IV in, so I'm going to choose dose calculation. Okay? And say I'm not really sure how to go about this, or I'm nervous about starting the cardizem drip. I'm going to invite another nurse into the room with me, and we're going to pick what we want. Usually the doctor will order milligrams per hour on a cardizem drip. So I'm going to choose that. Notice it came right to that, probably because that's what they usually do. And so they're going to ask me drug concentration in container. And I'm going to choose milligrams. And say I have a concentration of 1 to 1, so I have 100 milligrams in 100 milliliters. Now I'm not positive that's exactly how you do it, so don't take me literally, but that's so, and then I want it on the concurrent mode. But what I want is 5 milligrams an hour. So I'm going to go 5. And then it's going to, and volume to be infused in the total container is, I think it would be 105 if you were doing it that way. No, 110, because I think it comes, anyway, I'm just going to go 100. Okay. Duration is going to tell you it's going to last you 20 hours, and the rate will be 5 milliliters an hour because we did equal. Okay, so now I'm going to. Okay, so I did all that. Cancel back. Now I have to press. It says enter value using keypad. I did that. And I'm going to start. Deliver will be 5 milligrams an hour. Drug will be diltiazem, 100 milligrams, 100 milliliters. Oh, what's the patient weight? I don't need it. So that's 0. So confirm program. So this is where it shows you the screen again and says, are you sure this is what you wanted on there? And so you and the other RN can go, okay, yes, we want 5 milligrams an hour. Yes, it is diltiazem. Yes, the concentration is 100 milligrams per 100 milliliters. I don't need a weight to program this one because it's milligrams per milliliter. And so then I can confirm the program, yes or no. Yes, I'm going to confirm it. And now your patient's getting the cardizem concurrent with whatever IV fluids the doctor has ordered. So if you were doing, say say the patient's not doing well, the blood pressure's dropped, his feet are turning purple. We want to stop this therapy. We want to stop B. We want to stop program and cancel that. Okay. Now I want B. I'm going to go ahead and start A. Won't let me. Okay, so now I'm going to change the mode. I had to stop B, and then I went into the B program, stopped B, and then it asked me, did I want to clear the program? I said yes. So that cleared everything I had put in for the diltiazem, because now I'm going to choose a new therapy, because now the doctor has said I need him to go on dopamine. So we're going to go to dopamine. And really, we're not this nonchalant because it's really an emergency, but right now I'm going slow for you guys. So here we go. We found the dopamine, we enter it. We want a dose calculation. And notice how when you pick a drug, it goes to what you're going to need almost automatically. Remember with the diltiazem, it went to milligrams per hour. Well, with the dopamine, it goes to micrograms per kilogram per hour. So I'm going to choose that. And drug concentration, how much is it usually? It's like, I can't remember, but okay, so I'm just going to say 200, I'm going to choose milligrams, and I'm going to say concentration 200 milligrams in 250 milliliters. I don't believe that's right, because if I recall right, that's not right, but just for the purpose. Then you're going to need the weight in kilograms. And so say the guy is 60 kilograms. Notice I choose guy. And the doctor says start it at 3 micrograms per kilogram per minute. So here we go, 3. Volume to be infused would be 250. And that means your duration of your drip is going to last 18 hours and 31 minutes, and your rate's going to be 13.5 milliliters an hour. Then you're going to start. And then it's going to ask you, program dose calc, and then it's going to make you go through all this information again. Yes or no, is that what you wanted in there? And you're going to say, yes, that's what I wanted in there. And then you're going to sit down with your calculator and your piece of paper, and you're going to verify that this is correct. And this is a time when you want to have another time when you want another RN to help check your calculations. But you have to start this dopamine as soon as possible. The guy's feet are turning purple, his blood pressure's dropped, so we start it, then immediately we watch to make sure it starts. We want A to start too. We watch it, make sure it started. We check the patient, we do the blood pressure, but at the same time we're standing there with a calculator checking to make sure that this is correct. So we let the machine do the work, but we still have to verify that the machine is correct, okay? And that we put in the correct information. And any other questions, Anne?
I don't think so.
Okay, is there just basic operation? Any questions? You understand why I put the blue on there automatically when I set up even though the doctor hasn't ordered anything but fluids, it's nice and handy to have that on ahead of time. And that you can use 60 cc syringes to put in medications, that you don't necessarily have to have in a bag. So that you want say you want it over 15 minutes, so. Okay, I guess that wraps it up for the day. I hope I didn't overwhelm you with too much. Thank you.